does using cannabis influence neonatal outcomes in patients who are pregnant? Hey everyone, my name is Sarah Aguilar of Group 4.
And my name is Brenda Wong. Today, we will be taking you through a quick synopsis of findings surrounding neonatal outcomes of babies born from women who used marijuana during pregnancy.
Since cannabis's legalization in California, we have seen an increase from 14.5 million users to an astounding 19.8 million users. That is about a 5% increase in people aged 12 and older since 2007 to 2013.
Marijuana has commonly been used in medicinal purposes for anti-anxiety, anti-nausea, antiemetic, and pain relief. There has been a 62% increase in use of cannabis in pregnant women from 2002 to 2014. Due to the sensitive nature of cannabis, research results have been shown to be inconclusive and unclear surrounding negative birth outcomes. But why?
To answer this, research presents several limitations.
First, it has been difficult to determine definitively the frequency and amount of cannabis used. The majority of articles available were retrospective in nature, and variables such as dosage and frequency were not included in the research methodology.
On a similar note, it is difficult to distinguish the type of strain used and the amount of THC present within the strain. A quote from the American Journal of Obstetrics and Gynecology states, "Marijuana freely crosses the placenta and is found in breast milk."
Secondly, there is a hesitation for pregnant women to report their usage of cannabis, and this can be for a variety of reasons. There is a social stigma surrounding the usage of marijuana.
It can be argued that self-report measurement of substance use during pregnancy is subject to problems of poor instrument design, recall bias, and underreporting. The issues involved in women's reluctance to reveal their substance use include the illicit nature of some substances, fear of having their children taken into care, fear of legal consequences, shame, guilt, and recall problems. The prevalence of cannabis in pregnancy is underestimated. Self-reporting alone isn't an adequate measure of drug use in pregnant women.
Another limitation encountered is that many women who smoke cannabis also use other substances such as tobacco and alcohol. Therefore, it is difficult to identify the specific effects of cannabis on the fetus.
After separating for tobacco or other substance use, sample sizes were limited in number. However, considering our patient population and the sensitive nature surrounding a topic that was only recently legalized this year, even the findings in these small sample sizes are important to discuss.
Now that the biases are out on the table, we would like to share with you some of the findings we have encountered. Low birth weight associated with cannabis use has been by far one of the most heavily researched birth outcomes that we have encountered according to the studies in the Journal of Pediatrics, Journal of the American Academy of Child and Adolescent Psychiatry, International Journal of Obstetrics and Gynecology, and Pediatric Research.
It was found in the Journal of Pediatrics that prenatal cannabis use was associated with a 50% increased likelihood of low birth weight, independent of maternal age, race and ethnicity, level of education, and tobacco use during pregnancy.
However, there is also several articles listed in the American Journal of Obstetrics and Gynecology and the Archives of Women's Mental Health that refute low birth weight as a finding. Further, there has been studies conducted on the incidences of preterm labor in babies born with maternal cannabis use. Results show an independent association between cannabis use and spontaneous preterm birth that is 128% more likely to occur.
However, several articles from the American Journal of Obstetrics and Gynecology, the Journal of Pediatrics, and the Journal of Perinatology oppose the association.
In particular, the Journal of Pediatrics stated that the likelihood of preterm birth was not significantly increased for mothers who used cannabis during pregnancy compared with those who did not.
A mixture of other findings such as small for gestational age, NICU admission, and mortality have also led to conflicting results. The Journal of Perinatology found a 30% increase in small for gestational age and a 54% increase in NICU admitted women who used marijuana but were non-smokers, even when controlling for potential confounding variables.
So now what do we do with all this conflicting data? Despite results being inconclusive, it is still important to address the usage and prevalence of cannabis as its use becomes more and more acceptable in the society as a whole.
Because physicians have been prescribing cannabis to pregnant women as an anti-nausea medication, we should be consciously aware of these outcomes.
Moving forward, we recommend a call to find a more sensitive way to test for cannabis usage, especially in vulnerable patient populations, such as pregnant women.
Self-strain assessment of marijuana use during pregnancy, including questions about the type of strain and the duration and amount used, will prove beneficial for gaining a deeper understanding of any dose-specific effects that may arise.
However, let's not be discouraged. The prognosis for further research is good. Now that stigma and bias surrounding marijuana use can potentially decrease due to its legalization, further studies may prove to be more forgiving in both the sample size and disclosure of cannabis use.
As we continue in our nursing careers, it will be important to remain culturally sensitive and non-discriminatory towards our patients who use substances during pregnancy. Discussions surrounding the potential negative effects for their babies may prove to be beneficial for our patients.